the scientific information, lectures, and everything should be there. I think simulation of the clinic atmosphere and environment has to be there. I don't want anybody to think that if you go to course and you place implant on, or you do tissue grafting, and you know what, like this is really another thing, like soft tissue grafting. You can't do that on a table and you expect that you handle all these soft tissue from the palate. You get your graft and place it on another area. It is something easy. You can't do that. You cannot expect that the peg has the same tissue material like human. It's totally different, these cadavers. So in my opinion, when I would like to think about taking a course now, it has to be different. It has to be really structured in a way that I would like to do my work myself, and I would like to have supervision beside me. I would like someone to start the procedure first in front of me, and then I will practice another on a patient, but under supervision. So it's not enough that I place it on a table and then the following day I see a video and then, okay, I'm good to go. It's impossible. These videos are so helpful to remember the sequence of the procedure, but believe me, Nick, it is very different when you go in the operative room with that patient, giving the freezing and thinking about, okay, I'm placing this implant. What should I do now? It's very hard for people who start the next step. So I think, again, about how we can succeed in future courses is to really simulate these operative rooms. It can be Typodonts, it can be anything, but it has to be on dental chairs where I sit on that, my assistant on my side, and like I get the whole experience of placing implants. So when I go back now and place it in my patient, at least the sitting position, and it's not an issue.
It feels natural at that point, right?
Exactly. You don't have to think, where should you sit, where should you look to this implant, how should I look to the drip, because it's more easy for you now, and it's going to be like really best for your self satisfaction and how you feel inside the surgical room.
Yeah. One thing you had mentioned to me, which I found really shocking, was like in a course you were placing an implant on a typodont, and it's like, hey, it looked great. And then afterwards, you kind of had this realization of like, if this was a human head with jaws, like with cheeks, how exactly would you drill from this angle? Like you're coming in from the tonsils, like that doesn't make any sense, right? But no one kind of clued into that. It's like, you've got this like set of teeth on a table and you're like drilling in. It's like, okay, I know how to do it. It's like, explain to me how in real life you would ever do that. It's, you're not working on teeth, you're working, there's a head there. It was just really kind of bizarre that, these courses, which like you said, they're not cheap, right? Like you're not talking $500 for this course. A lot of these courses are tens of thousands of dollars. And it's like, this is the best they have to offer, what I thought was interesting is you're looking to create a course. Like at this point, how many implants have you done? Like, what would you ballpark?
Well, I mean, it's hard to count for 20 years, but if I go by year, I place almost like between 150 to 200 implants a year.
Okay,
so I would say around maybe 2,000 implants or more. I can't really count them. But I do statistics for implant cases every 5 years, and my statistics goes for like 4 dental offices, and it's about like 500. I take 500 patients, like a selection specimen, so that I know what I'm doing with this, for example, kind of implant, Straumann or Astra or whatever kind of implant you're placing. Because I have to evaluate the implants that we're using as well, the surgical.
The success rate of the different types of material. Okay.
Of course.